couple of patents for honey breast implants, and actually to prevent, one of them is actually to prevent capsule formation in breast implants, which is a real problem. And this is a book that has virtually my whole career in it. There's about 400 patient letters, and it talks about the research I've done, and most of that is on a website, visionarybreastcenter.com. Actually, the foundation doesn't have a website as yet. That's one of the things we could use the donations for, is to develop a really nice website. And I'll just take you through some of this other things here. I don't harp on this, but this is, I'm a recipient of the Carnegie Medal. I have it up here because I think it gives women a feeling like they're in the right place. This is something I'm really proud of. Back in 1988, I authored our country's first large-scale breast cancer prevention trial using a drug called tamoxifen. We went through that and developed it with the FDA, and it was going to be about $100 million. And of course, we didn't have $100 million, and nobody did for that kind of trial. 16,000 women over at least a 10-year period, with all the things they wanted included in the trial. And so I had the idea to do it with the Soviet Union, so we were invited there, and the whole team went over. That's a story unto itself. We were over there for about 3 weeks, including Moscow and Chernobyl. And it was not only to introduce the Soviets at that point in time to breast cancer prevention, hopefully, but to make the world safer too. So I'm really proud of that effort. We got an FDA open hearing in about 6 months, and the trial was approved. And government spent $68 million on that idea, and tamoxifen became the first drug. Now we have a couple, but it was the first drug to be approved to actually prevent breast cancer. So wherever the woman is, it lowers the risk by 50%. So when she hits menopause, can put her on that, and that's active prevention. So I'm really pretty proud of that. And it's the first time, that we got the drug companies to look at prevention instead of just treatment after the fact. This is another thing, another item here. During my 30 years at Eisenhower Medical Center in Rancho Mirage, which is where the Betty Ford Center is, I was on the heart team at Eisenhower for about 9 years, and we did over 3,000 open heart procedures, and we pioneered a procedure called left ventricular reconstruction, where you actually take out the left ventricle of the heart with a scissors and put a Dacron patch there, and patient's heart is better than it was when we started, so that was pretty neat. But it was an honor to be involved in Betty's heart surgery, which went very well, and she actually outlived the president, and they became very good friends. Just briefly, I try and write a paper in an abstract form. I've written one white paper. It took me about 6 months because I don't have any help. That's another thing we could use donations for. A statistician, for instance. But I publish, I probably have about, 8 or 9 publications in peer-reviewed journals. So I try to do that about once every other year. And this year is, we're going to do our 1,000 patients in our infrared study, so that'll be really good. If we move on here, this is our baby that we used cryo liquid nitrogen for to kill the cancer right here in the office, and I'll explain that a little as we go, but this is the probe, just so you know, and that's inserted into the breast through, we actually shish kebab the tumor under real-time ultrasound, and we freeze it. Liquid nitrogen is the second coldest thing in the universe at almost minus 300 degrees Fahrenheit, 180 degrees Celsius. So it just kills the whatever you have the probe on right then and there. So you have to, you have to have it right on the cancer. which we do with the ultrasound. This is a patient, Wilma, who was at a major cancer center in Texas. You probably know which one it is. She's 83 years old. She had 3 strokes. She had a palpable cancer about the size of a marble, and they wouldn't operate on her. I don't know why. They could do it under local anesthesia, but in any case, they weren't going to operate, and every night she went to bed with feeling this thing. And so she found me, and she came down. We did a lavender procedure on her, and she's doing very, very well. And actually, I'll tell you now, and why it's called the lavender procedure. We've been doing this for over 3.5 years now. And the first day I did it, I did 3, having never done one, because there's nobody around to teach this. You have to learn as you go. It's kind of like Abraham Lincoln. But the last patient we did, her name is Rosie, and her story's on the website. She felt so good immediately after the procedure. She said, "Geez, I'm hungry. Let's walk across the street to Lavender Bistro and get something to eat." So we all were over there, and within 15 minutes, she's drinking Chardonnay and having lobster salad. And my wife said, "Hey, do you understand what you did?" And I said, "Well, I hope we killed her cancer," which is still dead, by the way, 3.5 years later. And she said, "No, instead of waking up in a recovery room with a tube in their throat and their breast off or disfigured, she virtually has, there's not even a stitch, resumes normal activity, and then we go over there and have Chardonnay." And so that's how lavender procedure was born, and it's kind of a tradition now. Most of the girls feel, not all of them, but most of them feel like they want to go and toast killing the cancer, and so that's what we do. There it is. This is a plaque here. It's hard to see, but when President Reagan was president for 8 years, he was out here, and one of the Secret Service agents went down. We operated on him, and it builds character to have Secret Service watching you while you operate, asking you what something is. So that was pretty nice. We got a commendation from the White House. This is a picture of what is this?
St. Basil.
Huh?
St. Basil's.
Yeah, St. Basil's Cathedral, yes, pardon me. And the story goes, I smuggled this out of the Soviet Union, because you're not supposed to take any art or money out, but I smuggled that out. And the story goes that the Tsar had the architect's eyes put out, so he could never duplicate that. So come on in here, and I'll show you the war room where all the activity takes place. I'll just mention, here's starting here. This is our infrared machine. Obviously an exam table. Then our ultrasound machine, and I have the patient's mammogram if she has one here. So I can see her. I'll have the information from the infrared. I examine the patient. I know where the activity is. I can coordinate that with the mammogram and ultrasound. And so it's really hard for a cancer to hide. And the whole crux of this thing is divided into what I've come to call the Lavender Way and Lavender Procedure. The Lavender Way encompasses all the non-diagnostic, non-radiation diagnostic modalities that we have: genetics test, infrared, ultrasound, halo, and all these are meant to find cancers that are very small, that in fact haven't had the capacity to spread. So I was taught in the 70s by very aggressive surgeons to get it all, and we tried our best. The bigger the tumor, the bigger the knife we got out. Only it just doesn't work like that, does it? The statistics will bear that out. The same number, 40,000 women die every year, despite all the research, despite all the refinements on surgery, chemo, and radiation. Still 40,000 a year are dying. So I just asked the question a while back, did technology actually caught up to breast cancer if you bothered to look, which is what the problem is. We decided as a country back in 1971 when President Nixon signed the National Cancer Act to go after cancer with surgery, chemo, and radiation, and everything else was just summarily dismissed. So that's unfortunate because technology in the form of this device here, for instance, and ultrasound and halo and other things we use has let us catch up to this disease, to find these cancers when they're about 5 millimeters, which is about the size of an eraser head on a pencil. So the idea is that these centers that we hope to develop are staffed by dedicated breast doctors. One of the problems with every major cancer center that I know of is that the woman never gets to, benefit from all their knowledge, which is obviously they know a lot. But the women when they come, they come in with their mass, and then they try and scamper around and try and formulate, a comprehensive plan and all this. Instead of having those doctors in with the patient early on. So we do a genetics test that will not only tell the risk of the patient individually, but when that risk will likely manifest. And so using that as a guide, we form a personalized breast care for life and a personalized imaging sequence. So we know exactly how many of these to do. So as the time approaches when we think the cancer is supposed to show, then we start accelerating the imaging. Since none of these have radiation, we can do it as many times as you want. And the idea is, then we catch really small tumors. And then I can come full circle to actually get it all, which we've done in many of the patients that I've done over the last 3.5 years. And it's very, very gratifying. I was part of if there was you want to call it the Holocaust on women of taking just very aggressive surgery, a radical mastectomy where the breast and the muscles, chest wall muscles are taken off, and all the lymph nodes, leaving her with a lymphedema and a swelling arm and a sore shoulder for the rest of her life, and a big scar. And we just replaced all of that. And so the videos we're going to show you are actually, they're real time. They're not scripted. It happens as it happens. So you'll see, and what a difference it is. It's 180 degrees. Instead of somebody coming in, you'll see one of the patients says, "I'm here for the party." You don't say that if you got breast cancer and you got to have an operation. They're very sad. The family's sad. The family's in the waiting room, and they're saying, "Oh my gosh, she's been in there for 2 hours. What's wrong? Gotta find out what's happening." Well, actually, this is like a childbirth almost. The significant other, be it a husband or a sister or daughter, they can come in and hold the patient's hand once I get the probe placed, and it's really pretty cool. And actually, we had an 86-year-old who was in the midst of having her cancer killed. She's on the cell phone, which you'll see, talking to her son in Seattle. And so this is like, all this activity takes place at the Visionary Breast Center, and we called it that. I changed the name from Desert Breast Institute to Visionary Breast Center because the things we're doing now, I couldn't imagine 20 years ago that we would have this capability. Imagine if you're a general in the Army, how much benefit would it be for you to know the secret plans of the enemy? You could formulate a plan that you'd virtually win every time. You could cut them off at the pass, as they used to say. Well, with the genetics test, that's what we have. We know the secret plans of the enemy. And we didn't have that capability 10 years ago, but we do now with the study of the genome. And it's really pretty cool. And so I'll tell you a little